One of the things you mentioned, Lori, was the burden of finances when you're going through treatment. And Devin and Leah, your foundation has done such great work on this. It's a really big need to make sure that one of the stressors that families don't have to endure is that stress of, meeting the financial burden of caring for a child with cancer.
Yeah, so one of the main reasons why we decided to start the foundation, as Leah discussed earlier, one of her pastimes in the hospital was art therapy. So we would travel to the art room a lot to paint and color. And one time we were in the hospital, we went down to the art room, and there was a little girl sitting at a table by herself with an IV pole behind her and an IV drip going into her Broviac catheter. And she was receiving chemo treatment at the time as she was coloring. So me and Leah decided to sit at the table with her so that she wasn't alone. And about 5 minutes of sitting with her, she just started to open up and explain to us how she spent a lot of time in the hospital by herself because she came from a single parent household and her mom had to go back and forth to work in order to afford their bills, like their rent. And I was like, man, like this is crazy. Like somebody has to do something about this. And as I started to do more research, I realized that this was happening all over the country, all over the world, that parents were having to decide whether to keep their lights on or be in the hospital with their families. And I saw that a lot of the families, if you came from a two-parent household and one parent had to cut back hours on work or they had to completely resign for their job, and families were losing 40% of their annual household income due to cancer treatment work-related disruption. And that bankruptcy rates was 260% higher in households with cancer than similar households without cancer. And when you look at it, it wasn't just impacting the families financially, but when you look at how that financial burden impacts the trajectory of the child's treatment, it's insane because a lot of families have to take matters into their own hands, and they cut back on the dosage of the treatment so that it can try to make it last longer. Some of them miss doctor's appointments because they don't have transportation back and forth to the hospital. They're not eating meals every single day. We knew that we had to do something not only to help out families financially, but help the trajectory, a positive trajectory in their child's battle with cancer. And that's when we decided to start paying household bills such as mortgages and utilities, so families didn't have to worry about that financial burden as they're trying to do everything they can to champion their child through this battle with cancer.
Well, God bless you. That's critically important work, as you describe. And it's, you can be the richest person in the world and get told your child has cancer, and it's a horrible, horrible, horrible thing. But to have financial struggles on top of that is really much more than anyone should have to bear. So thank you for that work.